Hello and welcome to the Children's Environmental Health Network's annual Child Health Advocate Award presentations and panel discussion. We are so pleased to have all of you join us today. We hope that you have enjoyed and gained a lot from our programming so far, and we know that you will enjoy this portion of our planned events. For those that are new to the Children's Environmental Health Network, or CEHN, we are a national nonprofit organization that has been working for close to 30 years with the mission to advocate for the health, the well-being, the safety of all children, and especially those in the highest risk, protecting them where they live, learn, play, and eventually work from environmental hazards. We launched Children's Environmental Health Day 5 years ago as a day of action for and with children. It is a day where we lift up positive movement forward in the field and leverage community national actions that are getting it right. They may not have it perfect, but they're in the right direction when it comes to protecting our children. And we all know we could all use some uplifting and some positive stories and reinforcement in this day and age. We coordinate Children's Environmental Health Day proclamations, where we have a variety of governors and mayors from across the country that have proclaimed October 8th this year, 2020, as Children's Environmental Health Day. So we encourage all of you, partners, individuals, to utilize these proclamations, not just for photo ops, those are great, but to use them as part of your learning and education and engagement efforts so that your local officials can truly stand up and be better for children. It's kind of hard, I think, or it's very hypocritical to sign a proclamation protecting children and then to have a variety of atrocities happening, right in everyone's backyard. We also track Children's Environmental Health Day related actions that are happening around the country on our website. So if you have not checked them out, please do so. They become a great way to help motivate others across the country. Everything counts. Planting trees with and/or for children in your local community, establishing a meeting with your local school board or some other elected official or community leader about how you might reduce some toxins, known toxicants in your environment. It all counts and it's all vital and important. We'd also like to thank our Children's Environmental Health Day partners and sponsors for their incredible support and leadership. We appreciate you all, and all of their names are listed on our website. I'd also like to thank our incredibly dedicated and passionate staff at CEHN for making this day a reality this year, and that especially Hannah Gross. Hannah, could you wave if you're on? I think she turned her camera up. Our program assistant, who took a heavy load this year, and Christy Truesdale, our deputy director, who also worked extremely hard. And we hope that you definitely take a moment to appreciate the amount of time and energy that it took to pull this virtual platform and program together. I'd also like to take a moment and send along CEHN's wishes for all of you and your continued safety and great health as we live through this pandemic, rising levels of injustice, and increased implications of climate change within our communities. Due to all going on, this is the first time that we've held this event virtually, and our hope is that we can consider other ways moving forward to engage as many of you across the country and maybe even internationally on a virtual platform moving forward. So thank you so much, and we're now going to turn into our presentation of our awards. And I'm very honored to award our first CEHN Child Health Advocate Award in Science to Dr. Beverly Wright. Dr. Beverly Wright is an environmental justice scholar and advocate, an author, civic leader, and a professor of sociology. She's the founder and executive director of the D-South Center for Environmental Justice. The center addresses environmental and health inequities along the Louisiana-Mississippi River chemical corridor, otherwise known as Cancer Alley, an 85-mile stretch along the Mississippi River in the area between Baton Rouge and New Orleans, currently home to 156 petrochemical plants and 6 refineries. Dr. Wright's early work through the center focused on disproportionate siting of toxic facilities in this region, as well as fence line communities along the Gulf Coast of Louisiana. Over the course of her career, she has conducted groundbreaking, significant research that I know the Children's Environmental Health Network and many advocate groups, community groups rely on in a very informed and informational and important way on environmental justice, and we've all benefited from this milestone and monumental research. A recurring element throughout her work is that she embodies her commitment to the involvement of community leaders and young scholars in furthering the center's mission as it inextricably intersects with environmental and climate justice issues. She has demonstrated through countless initiatives and projects her sincere commitment to developing community and student leadership, something that's also very vital and important to us at the Children's Environmental Health Network. She has developed groundbreaking initiatives connecting HBCU faculty and students with majority serving institutions, environmental justice professionals, practitioners, and community residents in the equity and advocacy struggles facing these communities daily. Her lifelong body of work has often shined a light on the social inequities and precipitate the disproportionality in the way that environmental health, climate change, and other environmental challenges manifest and are addressed in low wealth, immigrant, and communities of color. I've had the wonderful pleasure of actually being mentored by Dr. Wright from afar for years, something that she probably is not aware of. I've actually kept up with her vital research, advocacy, community-driven solutions, and lifelong commitment to calling out environmental injustice. At CEHN, we see Dr. Wright's work as incredibly powerful and vitally necessary to our mission of protecting all children, especially those living within fence-line communities and marginalized communities. Without the groundbreaking science that Dr. Wright has led for years, we would have even more challenges in lifting up the community needs of the most in need and in harm's way. And I remember actually taking my first trip to go visit my husband's aunt in just outside of Baton Rouge. And I remember taking that trip a few years back and just being completely awestruck. And I had read about, I had seen documentaries on, I had certainly read much about Dr. Wright's work and many other environmental justice leaders about that incredible Cancer Alley corridor, but to see it in person. And I remember Dr. Wright thinking of you and just being so appreciative of you, because I was so in awe and so disgusted that, this was just a couple years ago now, right? This has been decades and decades and decades long of these atrocious types of pollutions, just kind of continuing to allow these permits to occur and to just continue to allow the air, our water, and beyond to be impacted among these communities, many of whom are working in these facilities. I remember just lifting you up, Dr. Wright, and just being so appreciative and understanding how big this struggle is. And I know that Cancer Alley is just one of many similar corridors in this country, just starting with the US, that is in vital need of serious attention, investment, and true appreciation for the families living there to lift them up so that they can actually not be exposed each and every day. So Dr. Wright, it is my complete honor to, again, present you with the Children's Environmental Health Network Child Health Advocate Award in Science.
Thank you, Nse. And I must say it's wonderful to see you this way. The last time I saw you, I think I was actually at one of these events where Dr. Robert Bullock was being honored in Washington, D.C. So I don't know how long it's going to take for us to be able to see one another face to face again. I'm hoping that it's soon, and I think the election will determine that. But we shall see. At any rate, it's wonderful. I want to thank you for this particular award, because and I have received many awards, but this one is especially important to me because of the emphasis on children. All of our work actually began with children. Working in the Mississippi River Chemical Corridor, Cancer Alley, really came about because women in the corridor were concerned about their children's health. The first thing that they noticed was whooping cough and things that really don't exist anymore in most of our communities, but was happening there. Asthma rates, cancer rates in children that were just unbelievable. And the women who approached me about their concerns, believe it or not, were concerns about their children. Of course, concerns about your children means you need to find out what's causing, all of the illnesses and diseases that exist in young children, a high death rate or mortality rates for infants. And with children being, some of our most vulnerable, and elderly people also ending up in that particular category, the Mississippi River Chemical Corridor was killing a whole lot of people. and people were sick and dying, but it was also killing the earth, the water, the soil, um, all of the small animals that community members would go in the woods to hunt for were disappearing. The moss on the trees was dying. It's hard to kill moss, by the way. And the only birds we saw were crows. I do remember the administrator for EPA, whose name I don't remember now, but she was a female, coming to Cancer Alley, and um, the community members decided to take her fishing, and what they caught were fish with tumors on them, and even, believe it or not, a three-legged frog. I never thought that was real, but it really is real. You know, all kinds of mutations with animals, not to mention the fact that the people who lived in the corridor could be identified by the spots on their cars, because the chemicals were literally eating the paint off of their cars. So if we saw someone with a car with circles on it that looked like something from outer space, you know, it circles with paint eating in circles all over the cars, we knew they were from the chemical corridor and they lived downriver from some really toxic facility. And so we began this work with our focus on children's health. And it moved from that to something really larger in our attempts to figure out what is causing this amount of sickness and disease in these communities. Of course, the chemical corridor the chemical plants were always suspect. I mean, you smelled them, you could see them, you would get headaches if you were in the area over a period of time. It was obvious to us that the cause of all of this sickness and disease in the chemical corridor was, in fact, these facilities. But another thing that was so striking to us was that white people didn't seem to be affected in the way that African Americans were. In fact, white communities had been bought out that were fence lined to communities, and Black people were left to languish. And so in our early research, we did a GIS analysis, which is really, really popular now, but you can believe it was not in 94. It was the first time it was ever being used, and we worked with EPA Region 6 and EPA headquarters to develop that tool. And what it basically showed us was that 80% of all African Americans in the corridor live within 3 miles or 5 kilometers of a polluting facility. It was just the opposite for white people. But it wasn't just one facility. You know, it was multiple facilities within those 3 miles. And sometimes it was closer than 3 miles, but it averaged out to about 3 miles. And the community was suffering from multiple types of cancers, none of which could be identified as being connected to a specific chemical. And so every time we went to court, we would lose because they couldn't make a connection between a particular cancer and chemicals that were being released into the air by these facilities. But of course, it was a cumulative impact that was having this effect, or the synergistic effect of multiple chemicals, and science had not caught up with the actual happenings on the ground as it related to the chemicals. They all knew it, but they couldn't prove it because the science didn't exist looking at multiple chemicals. And so our communities suffered for years and years longer until we figured out it's not science that could save us. Well, not the kind of science we were pursuing. It was political science that would have to win out. So we began strong advocacy, you know, harassment, education, and all of these things. That is what brought some of these facilities to the table, because they didn't like the fact that people were always demonstrating. And so my story is a long story because I've been doing this, I counted up, it's almost 40 years. I can't believe it's been that long. Of course, I was just a baby when I graduated from college, you know. So I tell people I was just a baby, but I did make 73 years old Thursday. So I can't deny that much longer, you know. I've been doing this for a long time. And I will continue to do it, you know, as long as I can. The main thing is though, bringing young people in so that they can continue. None of us are here forever or can do this forever. And I tell the first thing to go are your eyes, then your ears, but for certain, you see these big glasses, I cannot see. So the first thing to go is your eyes, but that doesn't stop anything. You know, their glasses, their hearing aids, there are all of these kinds of things that can keep you moving. And I vow to keep moving as long as I can. But thank you again for this award. I really, really appreciate it. Thank you.
Thank you, Dr. Wright.
Thank you, Dr. Wright, for your years of illuminating research and advocacy.
Thank you.
So this year, we actually have 2 Child Health Advocate Awards in science, and I'm really pleased to present our second 2020 Science Award to Dr. Mona Sarfiti. Dr. Sarfaty is the director and founder of the Medical Society Consortium on Climate and Health. She is trained in family medicine and public health and has had engaged in teaching, research, and advocacy for 40 years. Speaking of 40 years, as an academic faculty member with expertise in primary care, preventive services, and health policy, she has lectured at national and regional venues, including hospitals, health plans, professional societies, health departments, and government conferences. In the middle of her career, Dr. Sarfati worked for nearly a decade as a senior health policy advisor for the US Senate Labor and Human Resources Committee, where she planned hearings, wrote legislation, negotiated policy, met with constituents, and was a founder of the Foundation for the National Institutes for Health. Subsequently, she was a founder of the community-oriented primary care track at the George Washington School of Public Health, which is now the Milken Institute School of Public Health, Project Access, and the Primary Care Coalition of Montgomery County, Maryland, and also the Diabetes Information and Support for Your Health Group visit program at Thomas Jefferson University. Dr. Sarfati is the author of widely circulated guides and publications, including many peer-reviewed articles, 2 book chapters, and a public health text on climate change and health published by Jones Bartlett, which is due out, I guess, any day now, October 2020. So everyone keep an eye out for this and make sure to pick up a copy once it's released. She started her work with the Medical Society Consortium for Climate and Health in 2013 by assessing physician experience with the health effects of climate change in cooperation with the George Mason University Center for Climate Change Communication. And her work has been a powerful force in organizing and galvanizing our most trusted messengers, medical professionals, in the climate change action space. She received her medical degree from the State University of New York at Stony Brook and her master's in public health from George Washington University, and is an alumni of Harvard University. We at the Children's Environmental Health Network and within the children's environmental health community are so grateful for Dr. Sarfati's leadership within academia, education and training, health policy, and climate change overall. All of her important contributions have continued to shine a light on the importance of healthcare professionals, among other influential groups, and their important role within their communities for helping to reduce or reverse the implications of climate change, especially for our children and for future generations. So we're very pleased to present our second 2020 Child Health Science Award to Dr. Mona Sarfati.
Thank you so much for that introduction. And I want to say thank you to the Children's Environmental Health Network for this award and for your incredibly focused, determined leadership over the last 20 years and all the inspiration that that's based on and that it brings to others. It's really an amazing honor to be designated for this award, along with some of my colleagues whose work I'm very aware of and whose work I respect greatly. To be on the same platform with these other individuals is really moving, and it's greatly appreciated. For me, this is a little bit like the icing on the cake, because nothing motivates me more than children. And I would mention that my husband and I waited for quite a while to have grandchildren. And then all of a sudden it started to happen. And now we have 4 grandchildren who are under the age of 3.5. And of course, I'm very concerned about the future that they will have and whether they will inherit a world, an earth that is anything like the earth that we have been fortunate enough to experience as in our lives. And some of you know that one set of grandchildren live in Northern California. And my son recently, just a couple of weeks ago, sent me a photograph that was taken through the window of their apartment, and the background of the sky was red. I immediately thought they must be in direct danger from a fire. And so I didn't want to get overly alarmist. And I said, you know, how close is that? And my son told me, this is all via text, that in fact, that was just a red glow in the sky because of some interaction between the sun and the clouds, and that the fire was not in great proximity to them. But they had 3 air purifiers going in their apartment, and they were still smelling smoke, and they still had burning of the eyes from the smoke. I might mention that also that I trained in California, and so watching what's happening there has been, of course, extremely alarming. And we all know that all over the country, there are people that are being harmed by climate change today. They're being harmed by the terrible air quality, which results certainly from fire. All that smoke is basically just air filled with a lot of particles. And it's those small particles that get into people's lungs and cause them damage. They can damage lungs. They can damage the lungs of children as they develop. And the smoke can cause acute incidents for anybody, but especially for people who have an underlying lung condition or like asthma or like chronic lung disease, which affects a significant percentage of the American public. They can be impacted by the searing heat that we're facing during the warmer months of the year. And we know that over the last 10 years, heat has been the most common cause of fatality that is associated with climate change. And so all over the country, but especially more in some parts of the country, like the Southwest or the South, people are succumbing to extreme heat. And then we've got, of course, the tremendous storms, which have been made stronger because of the heat in the waterways in the Caribbean and the Atlantic Ocean that's associated with climate change. And then those extreme storms are pouring that much more rain down on communities, which become flooded. The energy that comes from the hotter water gets into the wind, and the wind then causes greater damage. The wind speeds are stronger and the damage is greater. And so you've got communities all over the country, but more in some areas, that are being impacted by these great storms. And then, of course, we've got the tick-borne and mosquito-borne diseases, which are spreading and are affecting more people and slowly moving and extending. And so we know that anybody can be impacted by all of these conditions, but some people are impacted more than others. And this can occur because of where they live. It can also occur because of the underlying medical conditions they may have. If they have chronic medical conditions, they're at greater risk. If they're pregnant, it turns out, pregnant women and their pregnancies are at greater risk if they're exposed to heat or to poor air quality. There's a very recent paper that was published in the New England Journal that comes actually from two of our members, two of the consortium members, that documents the greater risk to pregnant women. And then if you are low income or in certain minority groups that live in proximity to these dangers, you are also at greater risk. Indigenous people, minority people, people who have suffered racial injustice in the past. And of course, today's focus is on a huge category that is especially at risk, and that's children. Children breathe faster than everybody else because of their size. They have a different physiology. Their bodies are developing, and so therefore can be impacted by things like fire, smoke, in a more long-lasting way than adults can. And they spend more time outside where they're exposed to a lot of these problems more than adults may be. So children are especially at risk because of all of these changes that are associated with climate change. And so we know all of this, and we also know that if we don't act now, then all of these risks are only going to grow. They're only going to get worse. And so we must act. It really has become an emergency. Climate change has become an emergency. It's a health emergency. It's a public health emergency. But there is some good news. And the good news is we actually know what we have to do. It's not as though we can't chart a course to the solutions. We know exactly what the solutions are. And the solution is embracing clean energy quickly and in all the different facets of our lives. And the sooner we do that, the sooner will we have not only cleaner air, we'll also have cleaner water, because the water quality is impacted by all of these environmental exposures, as Dr. Wright just talked about so eloquently and has worked on for so many years. So water quality, air quality can improve as a result of decreasing use of fossil fuels and increasing our clean renewable energy sources. And I am reminded of some of the things that I worked on when I was a Senate policy advisor. Some of my issues included HIV and cigarette smoking, as well as some others. But, the cigarette issue, people thought we would never be able to do anything about tobacco smoke. And in fact, concerted action and coming together of advocacy groups from many different quarters of American life did eventually figure out how to take on the tobacco industry and to reduce smoking rates. And I realize that we have other challenges today in form of vaping and so forth, but we really did manage to largely defeat the risk of cigarettes. The smoking rate now is, it's really only a fraction of what it was before. We need to continue working on it, but we did make tremendous progress. And I would say that that's true with HIV as well. We had, many different advocacy sectors working to deal with the HIV epidemic, with the spread, with the treatment, and all of those efforts together decreased the risk and eventually led to treatments which have made it possible for people to live with HIV so that it was not a death sentence, which it had been before. So the point of these experiences that even for something that is as scary as climate change, and which has taken us as long to address as this has taken, there is hope. We can do something. And I would suggest that what we need to do is to continue to increase our networks and how the networks of advocates are connected to each other, and find out how to partner across issues and across networks so that our numbers grow and grow and get to the point where we reflect what is actually already happened in the court of American opinion, which is that the majority of Americans know that climate change and want to see some action on it. And that's true for many of the other problems that we face as well, that the majority of Americans know that the problem is there, that unregulated gun use, for instance, and want to see something done about it. And they feel that way about many other issues. And so I guess my appeal is that we figure out how to work across issue areas and form a juggernaut, a coalition that is so powerful that we can have the kind of political impact that we know that we need to have, and to change things, including addressing climate change and the needs of children who are exposed to unhealthy environments. So again, thank you so much for this award. I'm deeply honored, and I really, will continue to sing the praises of the Children's Environmental Health Network, which I respect greatly, and hope that all of the good work continues. So thank you again.
Thank you so much, and well deserved. I now have the honor of presenting, as a dear friend and colleague of mine, our CEHN Children's Health Advocate Award in Policy to the incredible memory and legacy of Janice Nolen. For 20 years, Janice was a national leading voice for healthy air for the American Lung Association. In this role, she supervised the development of policy positions on indoor and outdoor air quality for the organization. She was a nationally recognized authority on air pollution and a sought-after expert by a variety of news outlets. She represented the Lung Association with its many partners, including other public health and environmental health organizations, in addition to federal agencies on policy and regulatory issues. Janice was the driving force between the 21-year history of the Lung Association's signature State of the Air report, which has drawn significant public attention to air pollution control challenges and successes across the country, as well as the growing threat of climate change. And I know that we at CEHN rely heavily on that report for years, and have always been looking forward to the county level specific data that is so unique and has been represented, and have used it in a variety of our advocacy efforts. Janice also directed the Lung Association's actions in air quality, regulatory advocacy, and litigation. Her work in this area resulted in the strengthening of the national air quality standards for ozone, in particular particle pollution, She led the National Radon Action Plan Leadership Council that developed the US National Radon Action Plan to reduce radon risk in 5 million homes. She formerly served on the US Environmental Health Protection Agency's Clean Air Act Advisory Committee. These were all very critical ways that she leveraged her leadership, her knowledge, and her incredible passion to be an advocate on behalf of all of us, and in particular, those highest risk. Janice's contributions to clean air and lung health are wide-ranging and span decades. Before joining the American Lung Association, she spent 10 years working with a regional council of governments in Tennessee on community and economic development and alternative transportation. She also served with the Environmental Planning Division of the Tennessee Department of Transportation and had a Master of Arts degree from Middle Tennessee State University. I was very happy that I was able to briefly present our desire to award Janice this award before her passing this past spring. I learned so much from her in the 15 years or so that we had the pleasure of working together, getting to know each other, talking about our families together, and on a variety of air quality policy and advocacy efforts. Whether we were preparing for a congressional briefing, working on the National Radon Prevention Agenda, which I always sat in awe of her incredible leadership and passion in that arena, or the countless times that CEHN had referenced, again, her State of the Air report and ALA's efforts there. Janice's leadership has been inspiring to me individually, and I know a variety of our staff and board and partners. It was not only her fantastic understanding of policy and regulatory processes and how to mobilize protective action, but also her wonderful, warm spirit, her beautiful smile. She was a warrior for all children, and we are so lucky to have had her contributions to our collective work. We're so honored today to have Ken Rothbaum, Janice's dear husband, and Laura Kate Bender, her wonderful longtime colleague at the American Lung Association, to help accept this award in memory of Janice's longstanding legacy for current and future generations. And Ken or Laura Kate, if any of you would like to make some remarks, please do.
Yes. I can't speak to the policy pieces of Janice's work, but there's one thing that I can say unequivocally, and I think Laura Kate would, from the Lung Association, would back me up with this, is that she was a ferocious and tireless person when it came to, well, it came to everything, but in particular, what it is that she did at the Lung Association. And I'll give you an example, rather dramatic example of what I'm saying, and that is that Janice passed away in the middle of mid-April this year. She had developed ovarian cancer and survived for 4 to 5 years. But eventually that caught up with her, and there was no way to escape that illness. But the thing that stands out, and I miss her more than I can say, but I recognize that this is more than just a loss for me personally. It's a loss for the environmental community as a whole and the country as a whole. But she did the State of the Year report, as was said and mentioned, for many years. And almost at the very tail end of her illness, she, when she was weak and not eating very much and becoming a little bit cognitively disorganized, she realized that there was some work that she hadn't completed before she left the Lung Association. And so for 4 days, 4 evenings, I should say, she sat down at the computer and worked for 4 hours a night. She never got up from her seat, from the computer, never took any nourishment, but in 4 days, she completed what it is that she had to do. And that was the kind of ferociousness that I'm talking about. Once she would start something, she would take it all the way that she could possibly take it, and had my unwavering admiration for as many years as we were married, and still does. So we all lost a very courageous, honest, soft-spoken, gentle, extremely kind human being. And I am indebted to whatever forces allowed me to meet her and stay with her for so long.
Thank you, Ken.
Mm-hmm.
Beautiful. Thank you.
Thank you so much, Ken. And I know we at the Children's Environmental Health Network are very humbled to be able to honor Janice's legacy in clean air protections. Next up, I'm really pleased.
Oh, sorry, Christy. Ken, sorry, were you going to say something?
Well, I was just going to say that for all of the panel members, I've been thinking about this with Janice, that I think everybody there is leaving a wonderful legacy for their families and friends in doing what they do.
Agreed. So I'm really pleased to present this year's Community Advocate Award. This award is being presented to Ms. Latricia Adams. Latricia is the founder, CEO, and president of Black Millennials for Flint, a grassroots environmental justice and civil rights organization focused on the elimination of lead exposure, specifically in African American and Latinx communities throughout the nation. This work is clearly of critical importance to children's environmental health, as we know that any lead exposure to young children can cause cognitive and behavioral problems, and this disruption of healthy development can irreparably impact the trajectory of their lives. And it is our Black and brown children and their families who bear the brunt of this legacy lead exposure burden. It is simply shameful that in 2020, we have not eliminated this known hazard for many of our children. We in the children's environmental health community all continue to work towards this goal, and we know that LaTricea and her team at Black Millennials for Flint will continue to be critical to our collective success. Now, in addition to leading Black Millennials for Flint, LaTricea has had many notable accomplishments. She founded the first lead prevention commission in the state of Tennessee's history in 2019. And she was also featured on Bet's docuseries, Finding Justice, for her work to educate and address lead paint hazards in Baltimore housing. She is the immediate past president for the Memphis Urban League Young Professionals and Thursday Network, Greater Washington Urban League, and is also a former member of the board of directors for the Memphis Urban League. I don't think I have the time to list all of the awards she's received from her years of service. Needless to say, there have been many, and her leadership has been consistently recognized over the years. I will only mention two of her many most recent awards and recognitions. She received the inaugural Memphis Urban League Young Professionals Rock Star Award, named in her honor in 2018, and the National Urban League Young Professionals Honors Award in 2019. Currently, in addition to heading up Black Millennials for Flint, LaTricea also holds the position of Director, Organizational Quality for Shelby County Schools Office of Charter Schools in Memphis, Tennessee, her beloved hometown. And she's also a proud member of Alpha Kappa Alpha Sorority, Inc., and a terminal doctoral student at the esteemed HBCU, Tennessee State University. I can tell you that from our experience at the Children's Environmental Health Network, that LaTricea highly values partnerships and the community of our collective work, and she comes to the table with her sleeves already rolled up. She's usually among the first in our network to request and obtain multiple Children's Environmental Health Day proclamations from mayors and governors, to hold them accountable for their promises and to engage her community in the day. She is a lady of immeasurable energy and passion, and brings the evidence to back up her stated desire to be supreme in service to all mankind. So again, we're really honored to recognize LaTricea with our Community Advocate Award.
Thank you all so much to the Children's Environmental Health Network. It has been an absolute pleasure to partner with you all. I'm really so often intrigued by the creativity and approach of the work that you all do for the safety and protection of our children. I wanted to first begin by talking about the legacy that I like to use that term, that we created with Black Millennials for Flint. We definitely have Flint in our namesake, and I want to talk about why that's so. So while I was the vice president of Thursday Network, which is an auxiliary organization with the National Urban League Young Professionals, is when the country began to learn about the Flint water crisis. So this was about 2015. However, we know that the crisis actually started in 2014. And so, in the spirit of transparency at that time, and I always say in millennial fashion, I was really disappointed at the time, especially, being very active within a historical civil rights organization. So as opposed to just kind of taking to social media and complaining about it, I did something about it. So as mentioned, I am an educator by trade. So K through 12 educator. I was a former teacher and now a district admin. And so I hope that this experience serves as a model that anyone can work in advocacy and activism as it relates to environmental justice. So fast forward with Black Millennials for Flint, we started as a community outreach initiative where we responded, like many people did, to the Flint water crisis, which was direct resources with water. And so it wasn't until I met who is now a founding member of the organization, who is also the niece of another pioneer in the environmental justice movement, the niece of none other than Mrs. Peggy Shepard, the founder and executive director of We Act. Young lady reached out to me and said, I like what you did in Flint, but sister, you know that lead is not just an issue in Flint, Michigan. And so, when she said that, I'm from Memphis. I remember growing up hearing about lead paint chips frequently, lead paint. But what really resonated with me at that time is she said, did I know, or she asked, did I know that Freddie Gray experienced childhood lead poisoning? And so if you think about the timeline, I was actually one of the protesters that was out there in Baltimore during the time when Freddie Gray was tragically murdered by law enforcement. And so I was already angry about what was taking place, or what had taken place in Flint, but just infuriated at that point to just know the bounds in which environmental justice was so pervasive within communities that look like the very community that I grew up in. And so from that moment is where the movement started. And so one of the things that makes Black Millennials for Flint so special is that we really focus on a intergenerational grassroots effort. We believe that it is imperative for us to lean on our elders within the movement so that we can continue this work. And what's most important is to make sure that we control the narrative and make sure that everybody knows from this point forward that it was Black and Brown people who started this movement. Um, and while we have Flint in our namesake, and the majority of our time is spent uplifting the Flint community, we also have touch points within my beloved hometown of Memphis, Tennessee, which is also a very Black city with numerous environmental health issues, as well as Baltimore, Maryland, and also in our nation's capital. And so one of the things that we have been a champion in partnership with the Children's Environmental Health Network is around lead and water in schools. So it is unfortunate that in the year 2020 that it's not a mandate nationally. So there are a plethora of states that don't have adopted mandatory policies surrounding just testing for lead and water in schools. And so with serving as CHEN as a partner, we have been able to champion a bill in our nation's capital, which is one of the strongest, the most rigid bills around testing in schools. We got 2 bills passed in the state of Maryland and also here in the state of Tennessee. We are working hard in the state of Michigan, which is a different environment to get a bill passed. But we are confident in this next session that we will be able to be successful. So it has just been a phenomenal experience. It's an honor to be even in the same space with the Titans that have also received awards today. Just to learn from a Dr. Beverly Wright. I was speaking to you soon as you came on, you have just been such a pillar to our work. And you don't know this, as Nse mentioned, we study you. We just honor you so much in the work that we do, where we want to amplify the issues that are pervasive to people who look like us, just to make sure that they're educated on it, but then also empowered to act. And so we really focus on youth leadership and youth development, to ensure that while millennials are still technically young, the oldest millennial will turn 40 this year. So we're not the new kids on the block anymore. And so, again, we really model that intergenerational leadership pipeline that Dr. Beverly Wright has really set the tone for us to do. So again, it is such an incredible honor to just be in the presence of this great work. We are excited about the proclamations. I think that's one of the funnest things that I enjoy doing with the Children's Environmental Network, and it does indeed amplify the messaging from a local perspective, to hold our elected officials accountable to our most precious gift, which is our children. So again, thank you all so much for this honor, and most importantly, for the work that you do for our children.
Fantastic, so well deserved, and as wonderful you brought it as usual. Thank you, thank you. We're gonna give you all 5 minutes because this is a long time to sit. So please, if you can just, jump outside, take a break, turn off the camera. All right, see you in a few minutes.
Okay, the next two awards we have are the Nsedu Obot Witherspoon, otherwise known as NOW Youth Leadership Awards. The NOW Youth Leadership Awards were created as part of the Children's Environmental Health Network's 20th anniversary celebration back in 2012 in honor of Executive Director Nse Witherspoon. This award honors a young person, ages 10 to 21 at the time of the nomination, who has demonstrated exceptional environmental health leadership. This includes efforts to protect human health, especially of our most vulnerable populations, through actions including raising awareness of, advocacy for, and outreach around safer, healthier environments across places. So we are very pleased to present our Distinguished Now Award recipients. The first award goes to Sophia Kianni. Sophia is an 18-year-old climate and environmental activist who specializes in media and strategy. Her passion for environmental advocacy began after she witnessed the devastating effect pollution was having on her parents' home country, Iran. She is the founder and executive director of Climate Cardinals, an international nonprofit with over 5,500 volunteers translating climate information into more than 100 languages. She was recently selected to represent the United States as the youngest member on the inaugural United Nations Secretary General's Youth Advisory Group on Climate Change. She is also the host of the New Fashion Initiative podcast, interviewing everyone from sustainability leaders at Lush Cosmetics and Mara Hoffman to politicians like Tom Steyer. Sophia's activism has been featured in news outlets including Forbes, CNN, The Guardian, CNBC, and even on the front page of the Washington Post. She was previously a fellow with PBS NewsHour and has written for news outlets such as MTV News, BuzzFeed, Teen Vogue, Refinery 29, and Cosmopolitan. Sophia has been publicly commended by the Congressional Committee on the Climate Crisis and the United Nations Foundation for her advocacy. She is an adamant public speaker and has spoken to people around the world, from Doha, Qatar to Cambridge, Massachusetts. So as you can see, she is a true leader in climate action and environmental advocacy, and so very deserving of our Now Youth Leadership Award.
Thank you, Christy. And I will also announce our second Now Award recipient. Karina Samuel is a junior at North Broward Preparatory School in Coconut Creek, Florida. Karina serves as a financial director of the U.S. Youth Climate Strike. She's president of Bye Bye Plastic Bags Florida and is a Greenpeace volunteer. She's currently working on taking state-level legislative climate action through the Florida Ban the Bag program, and is helping to create grassroots movements across South Florida to mobilize voters prior to the 2020 primaries. Through Bye Bye Plastic Bags, Karina has raised more than $10,000 and has coordinated 30 cleanups in Tampa, Key West, Miami, and Fort Lauderdale, Florida. Karina is also an ACE Climate Action Fellow in the state of Florida. Florida Fellows push for clean energy locally and statewide, collaborate with partners on advocacy campaigns, turn out youth climate voters, meet with elected officials, deliver public comments at government meetings, speak at rallies and other events, and author posts for ACE's blog, collect petition signatures, use social media to engage friends and family in campaigns, and facilitate workshops at conferences, among other activities. Clearly, they are amazing, both of these candidates. Karina's commitment to climate justice and plastic mitigation has had a proven track record of success. She's excited to panel here at our Children's Environmental Health Day Children's Health Awards event, and it looks forward to continuing her environmental health work for years to come. We're very pleased to present Karina also with Children's Environmental Health Network 2020 Now Youth Leadership Award. We, due to the times we were in, unfortunately, we don't have both presenters here. Our hope is that you all will hear some of their remarks a little later in the program. due to a few emergencies that popped up, but we definitely want to make sure that you all at least had an introduction to these fantastic leaders that joined the ranks of a huge alumni, if you will, of youth leaders that we have awarded over the years. They're just moving and shaking, and we so appreciate them, and also can have a lot of lessons learned from them. We are now going to move into our panel discussion with our esteemed panelists here. So everyone, let's see, everyone's got their camera on, very good. So we all heard some wonderful contributions from all of your remarks that have been very helpful, and hopefully people were taking notes and I'm sure feeling enlightened and empowered. And we're hoping to drill a little further into some real action-oriented steps, strategies, examples, case examples, lessons learned, or just even highlighting some priority of areas that you may have for many of us out here in the children's environmental health space. So first question is, what children's environmental health wins might you be celebrating this year that either you were a part of, or you witnessed, or your community was part of, that you may want to lift up for the first part of this discussion?
So I can start, or okay. So one thing I would like to celebrate for this year, a close friend of mine who is also the youngest person in the state of Tennessee to serve as a state representative. She's also a phenomenal Black woman, and also the first Black woman to get an environmental justice bill passed unanimously in a very conservative state. And that bill was surrounding mandatory testing for lead and water in schools. Now, the bill was introduced by former state senator and now current mayor for Shelby County in Tennessee, which we all would recognize as Memphis. But this young lady is dynamic, definitely delving into an EJ bill is really hard. And for her, so young in her political career, to be able to get that passed was phenomenal. And from Black Millennials for Flint, our efforts in that to support her and getting that bill passed was just an amazing experience. And we're looking forward to helping her to get that bill even stronger. So that's a big win for us as it relates to children's environmental health.
Wonderful example, thank you. We definitely want to see more of those. Mona, did you also have something you wanted to jump in?
Yeah, I guess, our program is actually based at George Mason University in Northern Virginia. And some very exciting things have been happening in Virginia this year. The Virginia Clinicians for Climate Action, which is the state affiliate of our national group, Medical Society Consortium, Virginia affiliate called Virginia Clinicians for Climate Action has been a part of that. But the exciting things that are happening are that Virginia did pass the Virginia Clean Energy Act, which set a target for getting to zero carbon emissions by 2045. So that involved many, many organizations across the state of Virginia all pulling together and changing the politics of the state. And it just so happens that Virginia is off cycle to the rest of the country with its elections. So the 2020 election nationwide actually occurred in Virginia in 2019. And it was possible to flip a key seat in the Virginia legislature, which made it possible to get this Clean Energy Act passed. It's also going to make it possible for Virginia to join the Regional Greenhouse Gas Initiative, which is now 10 states on the eastern seaboard that have all jointly formed a carbon market and are trying to drive down carbon pollution, which is going to affect children. And there are many issues about equity that come up there, but increasingly there's awareness of those equity issues. And it's not just the total carbon, but also how communities that have been impacted more are going to be affected by the regional agreements. And so that's going forward. And there's another win in Virginia as well that some people may be aware of, but that's that the traditional free slave community of Union Hill, which had been targeted for a pipeline, mounted a very serious community effort to oppose the establishment of a compressor station for a gas pipeline, which was going to expose that community to more fossil fuel emissions and effluents. And so the community mounted a response, and organizations across the state, including members of Virginia Clinicians for Climate Action, wrote op-ed pieces and demonstrated and came together. And there was a legal component to this, and so there were legal suits that were brought. And ultimately, the pipeline company actually gave up entirely on even putting this compressor station or the pipeline. And so I thought that was just a great example of how environmental health wins that have a lot of implications for children and their future could occur when groups come together, forces come together and try to jointly make change.
Another set of fantastic, important examples. They don't happen overnight, but with fortitude and dedication and numbers of passionate community leaders and residents, it's amazing what actually we can see happening across the country. Every step is vital and important, not just for now, but for obviously the future generations that then will be living in these communities. Thank you, Mona.
Hi, I'm Laura Kate Bender, and I'm a poor substitute for Janice Nolen, but wanted to say a couple things on the Lung Association's behalf. One is that this year is the 50th anniversary of the Clean Air Act. We know that far too many communities are still waiting for the promise of the act of healthy air for all to breathe, but we've come a long way in 50 years. So it's a time to recommit to the continued work that needs to be done to fully protect kids from air pollution. I think also while we've obviously been stymied on the federal level, we have seen, as Mona mentioned, great progress in the states. I'll also just highlight that California, the governor just announced a commitment to transition the state to 100% new sales of electric vehicles by 2035. And as much as possible, 100% zero emission heavy duty vehicles another 10 years later. I think it'll be a part of all of our works to make sure that happens in an equitable way that prioritizes health, but it's a reminder that we can see enormous progress on the state level, even when things are tough federally.
Thank you, Laura Kate. So important. And we do know under this administration, right, the continuous attacks on just public health science, rollbacks of our air, our water, our basic public health provisions have been vast and are certainly having and will continue to have some impacts. So we're not out of the woods, even with a new administration, depending on how the election goes. But I definitely want to nod that the American Lung Association's leadership and the creation and protection and continuous efforts to protect. I know you bring us in often to be a child health voice among a variety of wonderful efforts that the American Lung Association leads, and we're so appreciative for that. So thank you for lifting that up. Dr. Wright, you had some comments. Uh-oh, you're on mute.
Okay, thank you. First of all, you would think we would know how to deal with all of this because we do it every day, but every now and then we just don't get it right. But I want to ditto what Mona was saying about what was going on in Virginia. I remember there was a huge EJ support network involved in that particular struggle. I even met the family that was going to be living right next to this station that had really retired and moved back home, and their life was about to be destroyed with this one station where the majority of the pollution would have been flowing right into their backyards or right next to them. So thank you for lifting that up. We have so many struggles that you forget sometimes how many you've been involved in, but I wanted to Victories are very hard. So I've been sitting here trying to think. The fights are numerous, but the victories are hard. And I think that one victory in my hometown of New Orleans was the city's climate resilience plan. Every city was supposed to pull together a climate action resilience plan. And the words may have been different. And when our office looked at it, we saw no equity in it. So we went to the persons in charge and said to them, you need an equity plan connected to this resilience plan, and they agreed. And so we were able to work very closely with them to produce this document that included equity first in all of the areas they were looking at for climate resilience, like transportation. And if you know anything about the city of New Orleans, poor people were left behind. The buses went underwater. They could have taken them out. The whole transportation system drowned while they could have been used to bus people out. So it was really important that we had those discussions, not to mention the fact that since Katrina, when African Americans mostly utilizing public transportation, where the community has been pushed out to from the city with gentrification, there was not adequate transportation into the cities now where they work. And before Katrina, they could walk to work, if you know what I mean. That close to downtown, it was really Black and historically African American. That's been taken away from us, and with no transportation now in. So the equity plan was, the climate action plan needed to include equity issues around transportation, around waste, all the areas they had lifted up. Nothing was being said about how poor people, or Black people in particular, in the city of New Orleans would fare. So that was a win. And I think the second win for us on a national level is that we are now in the process of reforming the National Black Environmental Justice Network, trying to get Black people all across this country to come together with a voice on numerous issues. That has gotten off the ground. I'm pleased to say we've been able to even raise money, which was a bit surprising, because I don't know if any of you knew Damu Smith. We loved him dearly. He started the National Black Environmental Justice Network and died of colon cancer at 54 years old. And so now we are trying, in his name, in memory of him, we are relaunching this. But the problems for African Americans, some people say are worse, and I can tell you, I've been around a long time. They're no worse, they're the same. It's just that they're more visible now. But I think it probably was worse when back in the day, what I remember, but nobody saw it. But because of technology, it's in your face. Because of mass media, we can get the word out. We're fighting the same struggle. I'm happy to say that at one point I was disappointed in young people. I just didn't think that they were interested at all. It was all about me. Remember that generation, Reagan, all about me. Even on our campuses, everything was about just starting businesses, making money. They didn't seem to care about community. That was a hard time for me, but I am joyful at this point because young people are really stepping up. And it's not just Black youth, it's white young people, it's Asians, it's everybody, which really makes me just so extremely happy. So starting the National Black Environmental Justice Network and trying to make certain that the youth element in this particular network is very visible and has a voice is what we're working on now. We're trying to build it again and build back better. Somebody else says that. That's what we're trying to do. That will be our slogan as well. So those are the two contributions I think have been good this year in the work that I do.
Those are excellent contributions. And yes, it's so exciting to see the National Black Environmental Justice Network
We
being
are
revitalized and ramped up. And I know Damu is just smiling.
Yes.
Thank you for that leadership. Well, another question I have, and thank you all for those contributions. We talk a lot of the Children's Environmental Health Network. We're knocking on the door of 30 years of existence. And if anyone knows Joy Carlson, our founding executive director, she speaks openly about how she never would have thought that there would be a need for an organization to still have to be around in 2020. And she said this back in 2010, you know, that would have to still be there rattling the trees and saying, but wait, what about children? What about vulnerable children? What about the vulnerabilities of children? How will that policy impact children? Why are children missing from this plan? Dr. Wright just spoke about resilience planning, which is great, you know, but where are the vulnerabilities of various community members being uplifted and considered? We know if they're not in the plan, they're very much not going to be part of the implementation. So we struggle a lot and talk a lot about moving action, training, moving education and training, and a variety of platforms of wonderful resources that are out there now, right? A lot of groups have been working a long time, a lot of communities have been working a long time to pull together educational components, toolboxes, and all of this. But I think a lot of you may agree with me in that one of the biggest gaps I see and what we see is still movement into action. You know, there's a lot of wonderful things out there. Many times I think we've recognized they have in the past, they haven't exactly been acquired or thought about thoughtfully about the audience that they're intended to be serving. Are these pamphlets, is the methodology of how you're trying to reach audiences, is it even realistic for who is trying to be on the receiving end? Have you considered all of the challenges that they have to receiving that information? But even when you consider a lot of those challenges, I still think when I get asked all the time, what are some of the biggest challenges you see that are still out there beyond the topical discussions we've been talking about, climate and lead poisoning reduction and air pollution, and beyond the topics themselves, I think it's helping people understand the gravity of these issues and that there is something that they can actually do about it. And there's that balance between this being very overwhelming and something maybe I can't touch, like climate change, right? To maybe even within my own realm, my own sphere of influence, my own home, for starters, I actually can make a difference. And when those changes are magnified at the community level, the state level, we obviously, again, have some of the examples we've just lifted up, change actually can happen. So where I'd love to hear from you all, how might you encourage us, the Children's Environmental Health Network, us working in the field of children's environmental health, to think about lifting up the strategies that you've seen or experienced that were helpful in actually moving education to action? Yes, Dr. Wright. Oh, you're off mute.
I did want to speak first because I just spoke, and one of the things in my personality that I learned from my mother was that you talk too much. That's one thing my mother told me all the time, that you have to let other people talk. So I was hesitant, but when you said models in education, I had to speak to the communiversity model that I developed, 30 years ago, and tried to implement it. And I have to tell you that for the first time, we've actually been funded to implement this model. And what has come out of it has been unbelievable. And so the model that we use is always connecting communities with resources from universities and other professionals. And right now we're working in 5 states with 5 CBOs, all EJ communities. And, you know, they force you to do this logic model, right? You have to do that to show where you're going to get in long-term goals. And we've reached our long-term goals. It's just been amazing because of the interaction between citizen science on the ground with community people being trained, trainer methods being put in place, faculty members from HBCUs who do this work for nothing during air monitoring, you know, testing sites, working with different agencies like EPA, ATSCR, all of these things coming together for our communities has absolutely been phenomenal. And then there was a policy action part of it. And guess what? In some of our communities, they have even run for office to be on commissions now. They have put forth environmental justice bills. One of our community members in CBOs in Pensacola, and looking at what happened with COVID, got with an engineer, and the engineer told him, well, we can put extended antennas on community centers. That would allow the community to have access to the internet. He brought that to our group, and we wrote some grants to get money for it. And for some reason, it wasn't funded. But guess what? His city council adopted it and put up $250,000 to put these antennas on all of their community centers in Pensacola. So when I can tell you that after working for like 30 years in this, with this model to get people to policy actions and advocacy, in at least 3 out of 5 of the communities, they are there. And they got there in a matter of, we've been doing it for 4 years with the kind of support that we need. And, you know, we believe in communities speaking for themselves. And so the attempt always is to instill within community members the knowledge that they need so that when we leave, they can carry on. My experience had been in the past when I first started that large white universities, well-meaning young white people would come to Louisiana for the summer over the holiday and just do fantastic work. But when they left, they took everything with them. And the community was still standing there with no leadership, no resources, no scientists, no anything that could continue. I saw that as a problem when I started the center in 1992 and began working with communities to educate them. I became a travel agent for most of them, sending them to EPA, to ATSDR. We had face-to-face meetings to instill the knowledge within community people. So then they can fight their battles, you still support it, but you move to the next one because it's such a huge job. It works. And I'm so glad that I've lived long enough to actually convince some foundations to fund us so that we can expand what we're doing, working with the scientists, we have a close relationship with the University of Michigan as well, because the white universities just have more resources, they do. And so we find good white people, good scientists who aren't there just to get tenure, you know, and promotion, but they really are there to work with the community, to work with us. And there are many researchers out there like that. And so I'm just excited about what we're doing and that it's working, and our communities are becoming more involved, more active, you know, to bring about change.
Thank you so much.
I have a segue that I think fits really well with what Dr. Wright spoke about. So Black Millennials for Flint got funding early on. We were really surprised that we got this funding, you know, like, who is this group of young Black folks? And we initiated something that we call the Lead Prevention Ambassador Program. And so we piloted this program in DC, and the program was initially it was targeted toward millennials, and then we actually brought it back to Gen Z as well. So now it goes from like age 18 up until 40. And so specifically with this program, it focuses on young people who are not necessarily environmentalists by trade. So you don't necessarily have to be a scientist or an engineer or in a STEM related field. And the reason why we want to do that is we want to expand the reach and the knowledge around just environmental injustices, period, but then also use and build capacity around transferable skills as it relates to community organizing and political advocacy. And so we launched that program in 2018. We're now in our 3rd cohort. And super excited. We started as a very small group in DC, and we now have had 4 different sites. and, you know, going into this next cohort. And one of the most powerful things I would say from that space is that we have to learn our history. So, and I know, you know, to keep bragging on Dr. Wright and like a Dr. Buller, but they should be in our history books, right? We think that, you know, as college educated, you know, African American and Latinx people, you know, I have 4 degrees, and, you know, I was well into, you know, my 30s before I even learned about some of this work that had already impacted me, my grandmother, you know, her mother. And so it's really been powerful to see the reactions of young people and how they've taken this information around environmental justice and included it into their respective platforms. So we really thrive on that coalition building piece, where we will bring in like a BET, for example, which was powerful because now you're talking about bringing environmental justice issues to a completely different audience, a completely different target, having an opportunity, you know, to be featured or adjacent to things that are more within pop culture, has really been powerful for us because we are really concerned about the messaging and making sure that it's not just siloed work, but it also, because environmental justice, and I mean, it impacts all of us in all aspects of life. And so I think that is something that really energizes me. And I'm the odd person out because, again, like you know, I don't have my PhD like Dr. Wright. And from a science or a technical perspective, but it's really been exciting to see people really taking to this information who would otherwise not be exposed to it.
Thank you so much, LaTricea. I would like to move to and production collaboration. We all know we cannot do this all by ourselves. And even if we had millions and millions of dollars planted at any of the doorsteps of any of our organizations, while that might be nice, we know that we need to lean on. All of you have spoken in different ways about the examples of what wonderful partnerships, effective partnerships actually lead to, as far as action and actually commitments and movement of policies that are supposed to be protective of the public. Excuse me. And then we also know that there are a lot of other partnerships that are in need. And we know that if we can bridge those gaps, what an amazing amount of jumping forward type of momentum we could gain by the collaborative intrinsic type of connections that we know this field of work protecting children. Doesn't matter your social economics, doesn't relate your faith background, where your zip code is. Usually most logical people want the next generation and the current children to be better off, safer, healthier. So to be doing the opposite of that is just counterintuitive of what we as human beings should be doing, right? So I would love on this last question here as we're wrapping up for you all to just uplift any creative, productive, new or revamped collaborations that you've been a part of in this next year, or ones that you would like to see into this next year, 2021, to just lift up. Yes, Laura Kate.
Thanks. So 2 that I'll highlight that I'm particularly excited about. One is that this year, the American Lung Association worked with American University's Center for Environmental Filmmaking and Center for Environmental Policy. The Center for Environmental Filmmaking put together an amazing documentary on the Clean Air Act. And it profiles how we got here, how this enormously successful law has cleaned up the air, but then also the work left to do, including by taking a trip down and interviewing residents of Cancer Alley. So I highly recommend it. Unbreathable.org is where you can view it, but I'm really excited to have a powerful tool that picture of the issues that we can share with people in a new way beyond us just talking about it. And then, I think largely because of the great example that Children's Environmental Health Network has set, we have done a better job of incorporating youth leadership into our decision making as we look at how to address climate change and clean air and how we talk about it, because we have amazing youth to learn from when it comes to their success in organizing on these issues.
Thank you so much. And I just would like everyone to know that Unbreathable, the film, is actually going to be part of our CEH Day program. at around 4 p.m. Eastern. So please stay tuned, and thank you for that wonderful promo. It's a very good piece. Thank you. And those are perfect examples of creative art, connections, because everyone learns in different ways. Everyone receives in different ways. What might motivate me to gain attention may not be the same for each and every one of you. So what I think, have all learned, the more we can diversify, ideally, the way that we touch, connect with people, our messages, no doubt, are important and will be received. People will move in them in different spaces with some technical assistance, help, support, that type of thing. But first we have to reach them and we have to touch them. And these issues of protecting children are extremely emotionally connected to most people, if not all people. So thank you, Laura Kate, for mentioning that. Any other collaboration ideas or desires that you're not seeing enough of?
Oops, can you hear me?
Yes.
So that's a perfect segue into an activity that our organization, the Medical Society Consortium on Climate and Health, has going right now, which is the Health Voices for Climate Action campaign. And we've got a series of about 20 and counting brief videos. They're 60 to 90-second videos, largely of doctors and nurses talking about their personal experience, giving stories of people who have directly faced impact from climate change and environmental threats. Many of those who are speaking are pediatricians, and so they're talking about children and the parents of children and what they've faced and what they've had to deal with. We are trying to share these on social media and Facebook and on Twitter. You can find them on YouTube at the Medical Society Consortium on Climate and Health, or on our website, which is docsforclimate.org. And so these videos are really attempting to get these stories, which all have an emotional component to them. That's why they've been selected, because they have a strong emotional component. They're intended to move people and help them to understand how important it is, especially during this election season. And the tagline for every video is, "We need leaders who care about our health and our climate." And so we're trying to motivate people to select during this election season, to select leaders who are really concerned about the environment and climate and the threats that we all face, and that we know are disproportionately faced by children and by communities that have faced environmental injustice in the past. And I want to mention one other thing, which I didn't mention before, which is that the call to action on climate, health, and equity, which is a policy action agenda and was released about a year ago, is now supported by almost 160 organizations of medicine, nursing, and public health, and schools of medicine, nursing, and public health, and 500 hospitals. And that call to equity, call to action is a 10-point agenda for addressing climate, health, and equity. And most of the points are beneficial to health. And we like to say that climate solutions are health solutions. And that policy action agenda may be found at climatehealthaction.org. And we are visiting Congress. We're using it at the state level. We have policy briefs that we're writing right now, which we hope will be of use to groups all over the country, both at the national level and the state level and local level, to address some of the specific issues that pertain to the challenges that we face. So thank you.
Thank you so much. All very important resources. I can't say enough from the Children's Environmental Health Network's board, staff, all of our partners, how just pleased, how excited we are. Again, I think, Dr. Wright, you brought this up. The only thing that could have been better is if we could have all been in the same room. Hopefully that will happen sooner than later. But we are just so honored that we're able to share this space and time. I believe you'll be pleased when you hear more recordings of this in the future, because the amount of information, education, experience that you all have shared has been phenomenal. And any of you who know, usually when we do our Children's Environmental Health Day event in DC in the past, I usually do a summary, or I attempt to, of what I've heard. And these are just highlights because it was just so helpful. What I heard, a lot of discussions about bringing young people in. I think we all recognize that, again, we cannot do this by ourselves. A lot of us are getting older. And at the same time, we're hearing terminology like climate anxiety coming from our young teenagers, having a hard time thinking about 30 years, 35 years, and that's not only a travesty, but just something that should not be on their shoulders. But we know their activism is also helping to enlighten us, helping to redirect a lot of us as adults. Increasing our networks and engagement, a lot of those themes, right? Again, lots of great examples of partnerships done right. There's enough examples in our history of partnerships done wrong and kind of abuse that has taken place in our communities. And as understandably, a lot of skepticism that communities have for working together and, being a part of different research projects and things like that. But I'd like to believe that those positive examples, those examples where communities are at the forefront, communities are leading the efforts, the community science that Dr. Wright talked about, those are the ones that we need to be leaning on. Those are the type of partnerships that we can continue to build our base of foundation of evidence. Not that we should have to do it, but it's there to promote the type of communities that all of us deserve to be living in, not just a certain few. When we talked about a lot of wins in the children's environmental health field, LaTricea, you mentioned the unanimous bill passed in Tennessee that requires mandatory lead testing in our schools. That's phenomenal. We do a lot of work in early learning and K through 12 environments. We know that learning spaces is where a lot of our children spend a lot of time normally, right? Pre-COVID. At some point, our children will get back in these buildings, and we do know these buildings have a lot of work to do across the country. Mona also talked about the great example of in Virginia. And Dr. Wright, you jumped into a lot of the community groundswell happening to resist and fight the compressor station that was slated to be there. Many of us have been in similar battles, and those battles haven't always been won, right? And the companies win out, and then we all know what the ramifications are to these communities. And even if we win, many times the efforts go to yet the just adjacent community, not far down, a couple miles away. Laura Kate reminded us of the Clean Air Act's 50th anniversary and all of the wonderful celebrations that we should never forget about what it took to even get that act to be established, but what we all know are the continuous daily fights to keep it as strong as it needs to be for all of our health and the ways to further improve it. We also know Dr. Wright mentioned the climate equity plan that has been worked in New Orleans to the climate resilience plan efforts. And I would offer there are a lot of wonderful state climate plans and regional plans and city plans, but I highly encourage all of us to take a deeper look at all of them. Who might be missing? Who might be some glare omissions as far as coverage perspectives missing? Because again, we know that if you're not even in the plan, you're not going to be lined up for the support, the funding, the capacity needed to implement that plan in a productive way that again is going to be truly representative of everyone in that community. Also, the reforming of the National Black Environmental Justice Network. Amazing. We're so excited to see that. I know I'm a part of that as well. And the Children's Environmental Health Network will definitely be a continued support of that network as it grows. And also the community model that was mentioned that's working in 5 states around environmental justice provisions and leadership, and in the interaction of citizen science with researchers, with community leaders, with community members. It can happen. It's happening. Right? So we need to be lifting up and taking advantage of these decades long of experiences that we have. LaTricea, I think you mentioned a lot of our environmental justice and other notable leaders should be in our history books, right? We should be lifting up these examples, because why should we reinvent the wheel when others have worked so hard to get us to this place of information and knowledge? And also, Mona, you mentioned a lot of the important partnerships, right? Towards the end here. So excuse me, the Medical Society Consortium on Climate and the wonderful connections that you have had for years now, lifting up the incredible influence and power of respected healthcare professionals, nurses, physicians, and many on the healthcare team, and how critical we know that they are for those that are able to see them, of them coming on board and being leaders and really being change agents and lifting up that when we look at climate solutions, we also have health solutions. So I could go on, but I just wanted to lift up some of the many wonderful lessons that I had heard, and I hope that everyone listening appreciates them as well. If you need to know how to find these wonderful leaders, you can find them online. We have their bios online as well. And I just want to thank you again from our standpoint. Congratulations. We look forward to working with you out there in the struggle and the fight. And I know our children certainly appreciate all your efforts. Thank you.
Everyone, thanks for your inspirations and your leadership. Congratulations.
Hello, my name is Karina Samuel and I am a Now Youth Award recipient. I am very excited and honored to be presented with this award, and am excited that it is recognizing something that I've put a lot of effort and have really developed my passions in terms of fighting for environmental justice and obviously the health and safety of children regarding the environment. And I'm really excited to be receiving this award and sharing company with some amazing environmental activists and researchers, and I'm going to be taking a lot of inspiration from the other people that were presented with these awards to hopefully further my education and passion on the subject. Thank you.